CT is one of the most important and commonly used imaging studies in the emergency department. The reason we love it so much is because it gives very high detailed and informative images very quickly. The entire imaging process can be done as quickly as 5 to 10 minutes. This affects the patient by exposing them to a large dose of radiation, but the flip side to that coin is giving or resulting in very high resolution images. CT is best for visualizing hard tissues like stones or the bones, but it can also visualize soft tissues, especially when given with IV contrast. So the IV contrast is given to enhance the soft tissues. The CT can also be used along with perirectal contrast or oral contrast. This visualizes the rectum or the esophagus and the entire digestive tract, respectively. For trauma cases, CT is especially useful, as it can visualize the brain and early signs of internal bleeding. So in cases where there is severe trauma in the patient, but you don't find a lot of results in the examination, the CT can be used to visualize the internal bleeding processes and also the alignment of the bones. So even if there is some mild internal bleeding that you did not find in the examination, or there is a mild fracture in the spine or the skull, they can be diagnosed very early using CT. CT brain is best used if the patient has some history of falling on the head or head trauma and they experience loss of consciousness, illucid interval, which is basically losing consciousness, regaining consciousness, and then losing it again. And this indicates intracranial hemorrhage. And for the abdomen, if the patient also has some severe blunt trauma to the abdomen, especially if the patient have other distracting injuries, like for example some mild abdominal pain, but at the same time the patient have bilateral femur fractures. Obviously the most pain will be produced by the femur fractures, and this will distract you from the abdominal pain. So if you have some severe distracting injury, you should also do CT for the abdomen and the pelvis to rule out any mild or progressing conditions in the abdomen, like internal bleeding. And if you're going to do the CT, especially for the abdomen, make sure to use IV contrast to visualize all the soft tissues. In cases of stroke, you need to act very quickly. While MRI remains the best tool for detecting early signs of brain ischemia and strokes, it takes time to do and it's not often done in the emergency department. CT can be used to rule out the hemorrhagic strokes, which often requires neurosurgery intervention. One of the most common cases that we see in the emergency department, especially in the surgical department, is acute appendicitis, and this is best visualized with CT with IV contrast. A lot of people think that we do ultrasound first and then we move to CT, but the actual guideline is if you suspect acute appendicitis, you should do CT with IV contrast, not ultrasound. We do ultrasound, not MRI, in cases where you suspect the patient might be pregnant, so you wouldn't expose the fetus to a lot of radiation, or if you have some general contraindications to CT. CT of the chest can be done with contrast most of the time to detect severe aortic conditions like aortic dissection. Of course, these severe vascular emergencies need to be detected very early and they require urgent vascular surgery intervention. Also, if you have some patient who suddenly developed tachycardia with low saturation and some chest pain or palpitation, you should think of pulmonary embolism. And this is best diagnosed with CT angio. Again, this condition should be treated very early, so the quicker you diagnose it, the quicker you treat it. And sometimes if a patient had sudden severe headache that they have never had before, or the headache is so severe that it does not respond to conventional analgesia, CT can be done to rule out the severe or serious conditions that can cause headache, like intracranial hemorrhage. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.